Welcome to the Healthcare Technology Report, a leading information source on healthcare technology companies and solutions. In this episode, we speak with Josh Schoeller, CEO of Qualifacts, a behavioral health EHR and data solutions provider serving more than 2,700 organizations across all 50 states, including a large share of certified community behavioral health centers. Qualifacts platforms support the full operational workflow for behavioral health and human services providers: intake and scheduling, clinical documentation, ePrescribing, billing, and reporting, so teams can manage care delivery and reimbursement in one system. Josh joined Qualifacts in 2023 after building and leading healthcare data and software businesses, including Enclarity, which was acquired by LexisNexis, and later leading LexisNexis' healthcare business. He also held executive roles at Elsevier and earlier spent 15 years at FICO. I am your host, RJ Lumba. We hope you enjoyed the show. If you liked the episode, click to follow. Josh, really great to see you. Thanks for taking the time.
Good to see you, RJ. Appreciate it.
Last time we were with each other was NYC Awards Night. Congratulations again on Qualifacts' award.
No, we appreciate the recognition. It was a fun night.
I thought maybe where we could kick off for the benefit of our audience is maybe to talk a little bit about Qualifacts and its history. It's been growing over the years, partly through acquisition. So I think there's an interesting story there, and the company's been around for over 2 decades. So if you wouldn't mind.
Yeah, absolutely. Last year, actually, 2025 was our 25th anniversary, our silver anniversary. So we celebrated that. And now on to even bigger things. Qualifacts was founded in Nashville, Tennessee, actually by the governor. At the time, he was the mayor of Nashville, went on to be the governor. So kind of fun history there. But then over time, went into different investors. And in 2019, our current investor built a thesis around some additional acquisitions that we could do for growth. So Qualifacts had CareLogic. We acquired Credible in 2020. The following year in 2021, we acquired InSync, which is our SMB platform. And then at the end of 2022, we acquired OnCall, which is our patient portal or client portal for integrated customer experience. So I came in October of 2023 and have been working on kind of what our platform strategy is for the next generation EHR. And it's been really exciting. And yeah, we're growing fast and continue to raise the bar on the value that we deliver to our end customers, our agencies that we support.
Mm-hmm. And you focus on the behavioral health space and EHR. Tell us about maybe the specifics to that solution and to that market, and maybe how big that market is.
Yeah, absolutely. So behavioral health is a broad category. It covers a lot of different things. Certainly mental health services is kind of our largest, but we do a lot in substance use disorder. We do a lot in intellectual developmental disabilities, foster care, autism, corrections. So there's a lot of different kind of offshoots of that. It makes it a very broad market. Today in the United States, 1 in 5 people have a mental illness or a mental challenge that they're working with therapists on. And so it's a growing market. I think the stigma of the past, where maybe people weren't as open about it, has really changed over the last decade. And of course, the way that services are offered has changed a lot too. So our focus is on community-based mental health centers that are out there working in our communities. A lot of them are non-for-profit, a multi-service line, really trying to meet all the behavioral health needs of a community and really help some of our most vulnerable populations live better lives. And so our software facilitates that central workflow from upfront intake, finding people, bringing them into the system, scheduling them, then the full clinical kind of care plan, treatment plan associated with how we help these people with the challenges that they're having. And then on the back end, the full practice management billing that makes these agencies sustainable. They have to get paid for the work they do so they can go out and do more work. And so we do end-to-end with integrated data and analytics. We have artificial intelligence that's built in. Now it's been a big push for us, better utilizing both generative and agentic AI within our workflows to bring down the technical burden for clinicians so they can really focus on their end clients.
Mm-hmm. And you have over 2,700 clients. How much further do you have to go? I mean, how big is this market in the US?
Yeah, we have 2,700 agencies, which correlates to over 20 million people that are currently on our platform that we serve. By our estimates, that's about a 20% market share.
Mhm.
So there's a lot more that we could go out there and do. It's a very segmented space. It's a specialty EHR for behavioral health. And so we have one competitor that's about our size. And then there's like kind of the tier two, which are a third of our size. And then there's hundreds of kind of homegrown and little systems that are out there that are, slowly being replaced just because it's a high burden to keep up with the compliance requirements, state level reporting, billing requirements. We now have nearly 1,400 employees. 600 of those are in R&D, engineering and product. And so they're working around the clock to keep up with all those changes, regulatory changes, as well as innovate on the platform to better meet the needs of our customers.
Yeah, and you touched on AI. Where did you first start leveraging AI, I guess within your solution set?
Yeah, so when I came to Qualifacts in October of 2023, part of my thesis was the value that clinicians get and their end clients get from the EHR is going to change dramatically because of AI. And so I got here and said, guys, what are we doing? And quite honestly, in October of 2023, we weren't doing a lot. We had a partnership with a couple firms. And I looked at those partnerships and said, we need to own this IP, the intellectual property, because the way that AI works is it's only as good as the data that you feed it. And we own the data. So it didn't make sense to have these third parties that didn't have the contextual data that we needed to better serve our clients out there. So within a month, we hired our first 2 full teams of AI engineers and started building our product. Our first product was a generative AI product that does ambient listening to a clinical session, does transcription of that, 20, 30,000 words that are exchanged during that therapy session, and then generates the clinical notes. And we started building that right around Christmas time on 2023, and we launched it to 5 alpha customers in April. So we built it in 4 months. Now, our original release was on telehealth only. It was in English only, and it generated very specific types of notes. Fast forward 12 months, it works in telehealth, it works face-to-face, and it works in a group setting with up to 30 people. It works in over 120 different languages. It not only generates the typical DAPS format notes, but it does forming and any kind of notes. We built an agent so that the agency can say exactly what they want to have in their notes. It supports compliance, so leadership can see how much of the AI generated notes are being used, how much are being modified. And so it's really become a premier product, integrated premier product out there in our market. And of course, now we've moved on to agentic. We launched agentic scheduling earlier this year, and we're going to be launching agentic billing, matrix updates, and agentic analytics and reporting by end of year. So exciting stuff.
So it's a great demonstration of how you've incorporated AI into your solutions. How about kind of how you leverage it within your own operations?
Yeah.
There's kind of different philosophies on how to do this well. Curious how you've decided to use it within your operations.
Yeah, no, we are all in. We're rolling out this to 100% of our product development lifecycle. So everything we do going forward our code will be generated leveraging AI. Now, of course, what we've done is we've built out what we call our cake layer, which is essentially the CMD, what the content that makes the agents work in the context of Qualifacts. So it has all of our code base, all of our documentation is all built into this. So it's referencing that. And then we've built 5 agents so far. So an ideation agent for product ideation, and then another product one that kind of breaks it into requirements at the sprint level. We then have the full code generator and then QA. And so all those agents have now been developed leveraging that cake layer. We rolled it out initially to about 80 engineers to kind of see what that would do to the velocity and what we could do very successfully. And now, between now and the end of the year, we'll be rolling it out to the remaining 520. So by end of the year, we'll be at 100% AI-driven PDLC. And what I'm so excited about, what we're seeing is just the velocity of the innovation is so increased. We have hundreds of ideas, product ideas that our customers have brought to us over the years, but they never quite make it to the roadmap because it's a good idea, but we have other things that we need to prioritize. So I'm really excited about being able to act on more of those. And then also, what I've told my team is we have always been a behavioral health EHR software company. Really, what this enables us to do is be a behavioral health software company that has the leading EHR. And the nuance there is we can start to create new software platforms that create greater utility for our end users. We're already their central workflow and their biggest technology partner. but they have to go buy an HRIS system from a different vendor, and they have to go buy a CRM from a different vendor, a referral management platform, fundraising platform, ABA for autism solution. And now we can start developing those very rapidly. So it really allows us to become a much broader software vendor within the behavioral health focus space.
Mm-hmm. The fact that you can develop these solutions, have them be homegrown, having the kind of contextual knowledge of your client base, has that at all affected how you look at acquisitions?
Yeah, it is. It's starting to. You might have heard we did an acquisition last month of Method One, which is a medication-assisted treatment for OTP customers, and we're really excited about that. But certainly, as we look, there's going to be a much higher scrutiny on why should we buy software if we can build it more efficiently. And I think there's a lot of factors that go into that, and certainly with our own company as well. If you're a central workflow with a really deep embedded customer base, there's a lot of value in that. If the software is highly compliant driven and has IP as far as content in it, those are all things that still make potential acquisitions interesting. But if it's a pure software play, I think they're either going to be lower evaluations or we will build it ourselves.
Let's switch gears a little bit and talk about you. You've got a long history in healthcare technology. If you could tell us a little bit about your professional background leading up to Qualifacts, because you had some really nice long stints at, increasing levels of responsibility at various organizations.
Yeah, well, you got to decide how far I go back. I'll go all the way back. I was lucky enough to land a job with a data processing company when I was 17 in high school. And I was fascinated with computer science and, what people were doing. Now, this was still on the mainframe, right? The dummy green terminal. But I got a job there as a general clerk and quickly got people to mentor me so I could start writing code. And so I started coding when I was in high school before I even entered college. And that was at a company called Dynamark that a year after I joined was acquired by FICO or Fair Isaac. And so I ended up spending 15 years at Fair Isaac. And over those 15 years through college and after college, I had to move out to New York City where I ran a consulting practice for them, but did product work, did technology work, did customer delivery work, did a lot of different roles. And then 15 years in, me and 2 or 3 other mid-level executives from Fair Isaac had an idea. And we spun out and started a company called Enclarity that was healthcare focused. And we built the largest master provider database of every single healthcare provider in the United States. Every doctor, nurse, chiropractor, psychologist, psychiatrist, social worker. If you were delivering healthcare, we built a database and we sourced that with over 2,000 sources of data. So we built this engine that could pull all these different data sources from things like state license and NPI and DEA, but also non-public sources as well, with an idea that we could offer that as data as a service because provider information changes all the time. And as it changes, it creates inefficiency in healthcare. So this is all about how do we make healthcare more efficient. I was there for 7 years and we sold it to LexisNexis. And so that was, I went right from going from FICO to starting a company to then LexisNexis, where they asked me to be the head of sales for their healthcare division, which at the time I wasn't sure because I wasn't a sales guy, but I thought I'll give it a try. And within a few years, I became CEO of the healthcare business at LexisNexis. And then a few years after that, they asked me to take on another Relics business, a healthcare provider business, Elsevier Clinical Solutions, based in Amsterdam, global business, and learned a ton about healthcare outside of the US, which was fascinating as well. And so I spent 10 years at Relics with managing those 2 brands. And then in 2023, joined Qualifacts. So it has been a passion project. Like healthcare, I started out in financial services. And as soon as I found healthcare, when you're in the elevator and people ask you what you do and you're a technologist at heart, being able to say you're building technology that helps people live better lives, that saves lives, that lowers costs of healthcare, that creates greater access, just makes me want to do it even more. There's a lot of problems to solve here. And so it's been a driver for me. And certainly that's been true at Qualifacts as well.
I imagine with your background, you probably get a lot of calls from, headhunters, recruiters, looking for leaders for healthcare technology companies. What was it about Qualifacts that convinced you, like, this is my next spot where I'm going to help build a company?
I was looking for a passion project and something that I was connected to. And my wife was a licensed clinical social worker. She went to Columbia and she's had her own private practice for 25 years. And so I've watched her. My mom was a social worker. She worked for the University of Minnesota in the IDD department. My sister's a master's in social work. She works for one of our customers and utilizes my software every day up in Minnesota. I could go on and on. My uncle ran the homeless program for Ramsey County in St. Paul, Minnesota for many years as a social worker. My brother has developmental disabilities and autism. And so I just had all these ties to throughout my life. I'm like the strange person in my family that went into technology instead of going into different behavioral health fields. So it felt like I understood what we were trying to do and the populations that this technology could impact. And it just made it a great fit. Not to mention, it's a great company. We're growing double digits in a very, up and coming space, great investors, incredible customers, all those things.
And had you had prior experience partnering with investors and pursuing an acquisition strategy?
Well, at LexisNexis, I acquired a lot of companies within those businesses. So, a little bit different than private equity, there's some nuances to it, but it's been great. Our investors are very supportive. I would say when I got here, my biggest mistake was I would go to our board and say, this is what I want to do. What do you think? And they'd say, we're investors. You're the operator. That's what we hired you for. Make your decisions. And so I learned that really quick. And we've made some great decisions as a business to really advance the value of the company and the value that we bring to our customers. So yeah, it's been great.
Have you developed your own kind of leadership philosophy, or did that kind of just happen organically as you were put in these leadership positions?
I would say it's a combination of emulating good leaders. We've all worked for great leaders and we've worked for poor leaders. And so I've tried to be a sponge and really absorb the good and make sure I push off the bad. There's certain things, Lencioni's 5 dysfunctions of a team is something that is always what I try to build my leadership around, that pyramid. If you haven't read that, it's a great one. But just generally speaking, servant leader, try to be egoless, try to always do what's best for the business. And we're a mission-driven business. We highlight our values a lot because I believe that culture is super important in a business, and we're only as good as the people that we have at the end of the day. I could be the smartest visionary CEO, but if I don't have people that can execute on it, I don't have anything. And so the most important thing at the end of the day is that we are developing our good people and that we're attracting good people in so that we can keep them and that they keep passionately performing for the business. And that's a big part of my job and part of my philosophy in being a CEO.
We're entering the tail end of the conversation. I have 2 final questions. One is, can you tell us about a person who has had a profound influence on you?
Oh, there's a lot. Let me see who I want to pick here. I'm going to say that the CEO of Enclarity, the startup that we did, Sean Downs, he's still a CEO out there. Number one, he was just a very empathetic leader, cared about his people, he cared about the customers. And when we founded the company, one of his philosophies is he said, listen, we left Fair Isaac for a reason. We're corporate refugees, right? We're refugees and now we're starting our own thing and we can do it our way. And we're going to do it the right way. And we wrote bylaws. And like one of them was we had a no asshole policy, pardon my language, but it was really foundational in learning that you can be in a for-profit business and still do it with integrity and do it the right way. And Sean certainly imposed that on me. And, he founded the Sumba Foundation, which is went to an Indonesian island and ended up doing fundraising in California where he's from, where he wiped out malaria and drilled 13 wells and built a school and built a hospital. And you have to balance your ambition out there and to make a living and do your work with passion and helping the world be a better place. And Sean exemplified that, and something that I've always tried to do as well.
Last question. Can you tell us about a charity, cause, or other endeavor that you're passionate about?
Yeah. I mean, right now, what I'm really working on, we launched a new program within Qualifacts this year to try to get all of our employees giving back to the communities. We work with these amazing agencies that are out there doing some of the hardest work every single day, helping people who are living under a bridge or, contemplating life or, all these just really heavy, difficult things. And these aren't the highest paid people. They're out there doing it because that's their calling. And I'm trying to bring that feeling into the company. So we sponsored a full day off for everybody. They can use it when they want within the company to go volunteer. Obviously encouraging them to look, if they don't have a place that they want to volunteer, to do it with one of our agencies. We're in all 50 states. So there's generally one of our clients is near you. But yeah, just trying to do more in the community to give back, whether it's with your local church, whether it's with your local shelter or food bank, but really trying to emulate what will make our communities better, and I think really help our agencies that are out there on the front line.
Wonderful. Josh, I want to thank you again for taking the time. It's been a great conversation.
Thanks, RJ. I appreciate it.